Hi, I am Dr. Kate Mills, and I am owner of Be Balanced Neurological and Vestibular Therapy. I'm a physical therapist, and I specialize in the treatment of people with neurological conditions, largely stroke and Parkinson's. And today I wanted to talk about my stroke clients. And specifically this week, I had a client come in who was frustrated, upset, discouraged, just based on a quick visit with his neurologist that told him that after about 3 months, and definitely after 6 months, that he really shouldn't expect to get significant gains with his deficits, and including with therapy. So this is not the first time or even the 10th time I've been treating stroke patients for, more than 20 years, and it won't be the last time. But it just struck me this time because I have now some platform that I want to try to reach as many people as possible, people who have had strokes, family members or friends that have a loved one in their lives that have had a stroke. That is absolutely false. It is not my opinion. It's not because I'm, Pollyanna-ish and glass is always half full, and if you just keep going, you can do whatever you want. It's not at all that. I mean, all those things are largely true, but it's science. And I think it can be really hard for people to hear or to kind of comprehend that a good doctor, a doctor of theirs, I mean, maybe it's not a neurologist, which is even to me more frustrating, but maybe it's their primary care doctor that they trust and they like a lot, has been their doctor for ages. And it makes sense that they would not question something that a trusted medical professional would say. But I want to kind of break it down along the lines of, to maybe make it a little more sense. This is similar. Doctors, and specifically neurologists, their area of specialty, where they see patients involved in the stroke process, is immediately following a stroke, and largely within that acute, subacute phase, whether they're seeing them in the hospital within the week of the stroke or subacute within 3 months after the stroke, to go over their risk factors and making sure they're keeping those under control. Their jobs are to look at the brain scans, look at where the stroke was, again, look at risk factors, and advise, prescribe medicine to help decrease cholesterol, get blood pressure under control. So their job is medical, to medically assess the situation and determine how to prevent it from happening again, and how to help the patient deal with current symptoms of their stroke. Sometimes it's neuropathy, pain, sometimes it's anxiety, so things like that. It's a medical solution as much as possible to the stroke. They are by no means experts, and some don't even have real cursory knowledge on actual stroke rehab and what it does, what it entails, how it works. And that's even talking about just going to an outpatient clinic and seeing a regular old physical therapist for your stroke rehab. That's not what patients following a stroke should be getting in the first place. So let's set that aside. The whole idea of specialty stroke rehab is what is needed following a stroke. But so if you look at it in that context of what they actually specialize in, and they can be extremely good, knowledgeable, trustworthy physicians in their space. That does not make them a trustworthy source of information on stroke rehab. It would be similar to me, as I itch my head, me going to my hairdresser who sees a lot of scalps and has seen my scalp a lot for many years, even more than I've been married, and asking her what she thinks I should do about my psoriasis, what medications she's heard have been effective from all the people she has seen with psoriasis and what they've taken, what's been effective, how long does she think that the medication would last. I might do that. I might ask my hairdresser if she's heard from her clients, but I am not going to base my choice of treatment on my hairdresser's recommendations. She's amazing. She gives me excellent reddish color. She does magical work for my hair, but that's not a great idea. And that would be obvious to most people. The lines get grayed when you're dealing with medicine and somebody that is trusted and respected in a lab coat with a stethoscope. You just assume the things they say to you are based on research and specializing, and nobody should ever take any doctor that says that to them, that stroke rehab is largely ineffective after 6 months. You should just walk out and say thank you for your time and look it up for yourself. I will be listing some resources with at the bottom of this video. What people largely are talking about when they say that is that spontaneous recovery. So without any intervention at all, within the first weeks to month after a stroke, up to 3 months, you will see largely all of the spontaneous recovery that you're gonna see. And that's just people who get a, limp, flaccid arm after a stroke. Within 3 months, whatever start of, finger movement they're gonna start to get, or all of a sudden, each day they start to see a little bit more in their arm and maybe they can grip things. That's spontaneous recovery. That is what will happen as your brain sorts of heals and those chemical processes in the brain all settle down. That's what you're going to start to see. That is within those first 3 months. And then just with general rehab, meaning somebody walking you, using that leg, using the involved leg and arm, somebody directing you to pick up things using that stroke involved side of your body, that type of directed therapy is going to be the most effective in the first 6 to 9 months, a subacute phase. But neuroplasticity, which is now, I feel like such a buzzword, which is awesome that it's a buzzword, but understand what it means. Most people just think of it as they understand that our brains are able to change as we give them more information and we teach them new patterns and habits. But specifically following a stroke, if you are attending neuro rehab with a PT or OT that specializes in stroke rehab and neurodevelopmental techniques, you are doing things that cause new pathways to form in the brain. So when you get that little portion or big portion of the brain that has the stroke and those cells die, they're not coming back. That little area that is involved in the stroke, it's gone. But what happens quite miraculously with the proper retraining is that other pathways start to form as you have your involved arm. And there's a technique called constraint-induced therapy. Again, this is a very specific neuro rehab technique. And at its most aggressive in these research trials, they would actually, okay, I don't think they're tying people's arms behind their back. That seems aggressive. But they would constrain their uninvolved side, which is obviously easier to do with the arm than the leg. But so they're basically putting it in a sling, tying it to their side, and they are forcing them, no matter what the situation is with that arm, they are saying, here's a plate of food, feed yourself. And no matter how horrible it looks like at the beginning, and they're throwing stuff all over the place, it's ugly, it looks horrible, but constraint-induced therapy, that is what just that focused attention that person has to give to that side of their body, because they're doing something meaningful, even if they're getting just a few crumbs in their mouth. Day after day, and in these studies, this would be like every day for hours they're doing this. A week or two later, they're able to get stuff in their mouth. The movement gets more smooth, gets more coordinated. That is because in their brain, the part of the brain that controls that in this case, left side of their body, so it's on the right side of their brain, it is like putting out like bat signals saying, we need to move this arm. She's trying to use the wrist. She's trying to grip the fingers. She's trying to pinch the utensil. We need to figure out how to help her do that. And the more that I keep trying to do that, the stronger those connections start to develop. And it does happen. And that can be 5, 10, 15 years after a stroke. It's talking about, if you're just talking about regular old therapy, having a therapist hold your hand and walk you down the hall and see how much better you can walk week after week, month after month, that's largely going to plateau. That progress is largely going to plateau in 6 to 9 months, and definitely a year. But if you want to see real results, you shouldn't be doing that crap anyway. You should be doing the hard work of neuro rehab. And for that soapbox, I have a whole series of YouTube videos titled something like Unpopular Opinion on Stroke Rehab. And it's largely around throwing assistive devices, canes, in patients' hands following a stroke. But yes, so please do not take the word of anybody who is not a neurotherapist what your odds are, or what your window is for improvement following a stroke. There is just so many variables. I mean, I could just throw one out there right now that I always get people surprised when they come to me and their involved side is their dominant side. So as soon as I realize that, oh, you're right-handed and it involved your right side, my automatic response is, oh, that's fantastic. Of course, they don't really feel that way. But research shows that because that pathway on that dominant side, as you can imagine, is already so strong, you're eating with it, you're writing with it, you're doing your hair with it, you're all the things, that when you have a stroke, it's so much easier to get that back. My job, and I teach caregivers and family members because it's their job too, because 2 times a week, 3 times a week is not going to cut it, is to remind you not to ignore that side, which is so easy. So going to somebody who knows that there's so many different variables, age, dominant side, level of physical fitness beforehand, motivation, environment, so many things that go into what determines your outcomes, your prognosis with rehab following a stroke. Just go to see somebody that has all that knowledge and information and can do an assessment on you, if for nothing else, just to say, yeah, I actually do that with a lot of my patients. I'll just say, most of my patients I get at least a year after their stroke. I'm in a rural area, and a lot of times they don't even realize there's such thing as a neuro rehab therapist until they hear it from somebody who has had that type of therapy. So I'm getting them after everybody's had their shot and they think they're done, and they're very much not done. So it's so important that just don't give up. Don't take anybody else's word for it. Go get an assessment, and when you make your appointment, make sure to do your due diligence and a little interview saying, how many stroke patients does this therapist see? Is this a specialty? If not, can you refer me to someplace that is specializes in stroke rehab? Okay, I think that's it for now. I'm going to be getting another series going if I go any longer. Okay.